Welcome back to Long COVID Doctor, an educational series for long COVID sufferers. I'm Dr. Tim Robinson, formerly a family doctor, a GP for 30 years, now working in Long COVID Services for 5 years. I post on podcast channels and YouTube. I hope you find them helpful. If you do, click subscribe, spread the word. Thanks for any feedback. Apologies. No replies from me, I'm afraid. Not enough time, unfortunately. But they're appreciated all the same because they help me with my future postings. So another apology, important though, is my usual disclaimer, and that is any advice or treatment that I mention should only be considered after discussion with your own doctor. So, this talk is all about long COVID brain fog, and I've divided it up into two parts to make it more digestible, less overwhelming, less tiring. So part one, I'll talk about the causes and various aspects of long COVID brain fog. And then in part two, I'll talk about how to tackle it, the strategies and the outcomes. So here we go. Long COVID brain fog. Long COVID brain fog, aka otherwise known as a cognitive impairment. Okay, it's a common symptom in long COVID, I'm sure you'll agree. But before we get into it though, let's be sure that it's not something else. Okay, that brain fog, that symptom of cognitive impairment, brain fog, is not due to some other problem that you may have, and actually it's just coincided with your long COVID. It mustn't be, as we call it here, long COVID blind, because you've had long COVID, because you have long COVID, and then you've got brain fog on top of that. Is it the same thing or is it something else? Because there are other conditions that mimic brain fog. So age-related memory impairment, okay? There's dementia, of course. There's Alzheimer's dementia, but also multi-infarct dementia. There's anxiety and depression that can manifest with brain fog. It's sort of thinking that's not as clear as it should be. Some medicines can bring about the symptoms of brain fog, especially those sort of symptoms, those medicines that work on the central nervous system, the brain. Diabetes, that can, if there's cardiovascular complications as a result of your diabetes, that may lead to brain fog, not fog. So the point I'm getting to is that actually the symptoms of brain fog are not necessarily only explained by long COVID. They could be other things. So what do you do? Basically, if you've got something new, any symptom, anywhere, what do? You go to your GP. The GP will talk to you, maybe examine you, maybe do some blood tests. The GP is looking for those other causes for your symptom, and in this case, brain fog. The GP is also looking for red flags. So what's a red flag? A red flag is a symptom or a sign that is serious, sinister, that maybe suggests other more serious conditions. So unexplained weight loss would be a red flag. That could be cancer, couldn't it? Or recent neurological deficits, something neurologically not right, one-sided weakness, double vision or balance problems. Is it a stroke? So that's obviously more serious. Those are red flags. Other neurological red flags would be, there's a massive change in personality of recently, or inappropriate behavior. New onset of getting lost or dangerous driving. Something's not right here. Those are red flags. Or new onset headache. Never had them before, and significant severe headaches. But all those are red flags. Whilst we're on headaches, so a lot of people who have a new onset headache sort of think, oh my goodness, is this a brain tumour? Well, I just have to say that headache is almost never a symptom of newly diagnosed brain tumour. So just to put your mind at rest. So obviously, if the GP does detect a red flag, the GP will send you for checks, assessment in hospital, or a hospital specialist, a neurological referral for an opinion, and probably even a scan, a brain scan. A lot of patients actually ask for brain scans here in the Long Covid services. But really, actually, it's probably not necessary as long as there are no red flags and nothing that the GP has detected that suggests anything overtly neurological. Because a brain scan itself won't necessarily change the management of your long COVID brain fog. So there we are. So it's, as I say, a matter of making a diagnosis and excluding other causes for your brain fog. So if those have been ruled out and those other causes have been excluded, then we're left with brain fog because of the long COVID. What are we going to do about it? So, well, first of all, brain fog, let's sort of think about that a little bit more, the symptom, what patients call brain fog. I've got brain fog, doctor. I say, what does it feel like? What's it like living with it? And, what effect does it have on the patients? Patients describe sort of feeling mentally slow and foggy, fuzzy, spaced out, disconnected. These are all sort of like descriptions that I've heard so many times over these last 5 years. People say, when I'm trying to think, it's like wading through treacle. I really need to concentrate to think. I've never had to do that before, they say. And, other things like, they lose the thread mid-sentence. And they say things like, what was I saying? Or word-finding difficulties. And then people say, well, it's on the tip of my tongue, and that you can see them struggling to find the word. It's on the tip of my tongue. There may be strange sort of activities or actions or mild confusion even. I remember, so one patient said, the husband said, why did you put the car keys in the fridge? I mean, that's bizarre, isn't it? Very bizarre. And she, the long COVID sufferer, had put the car keys in the fridge. Odd. There's also difficulties with what we call executive functions. Executive functions are like problem solving and planning and decisions. Normally, before long COVID fatigue, long COVID brain fog, the patient, can sort things out, make a decision easily, unpick problem, no problem. That's a new thing, difficulties with executive functions. And then finally, this is the one that does scare a lot of people, and that is poor short-term memory. Long-term memory, no problems. They can remember, who people are and what their history is, etc., and their where they lived when they grew up, etc. Long-term, no problem. Short-term memory. Now, what did I do yesterday? No, what did I do this morning? I can't remember. Short-term memory. It's really worrying. I'm going to start right from, get to what a lot of people immediately are thinking, and that is, with their brain fog, they immediately panic and think, my goodness, this is dementia. I've got early onset dementia. Well, right. Okay. From the outset, I'll say long COVID brain fog is long COVID is not a direct cause of dementia. It is not a direct cause of dementia. Okay. You may have heard of this thing called amyloid protein in microclots, and I've mentioned it before in other podcasts. So this protein that has been found in blood clots in patients with microthrombi with long COVID. What I would say is the amyloid is different to the amyloid that is found in Alzheimer's dementia. Okay, Alzheimer's dementia, there are a couple of cellular changes. There are what we call sort of tau. There are tau particles, tau twisters, as well as amyloid. Amyloid protein laid down in the brain, and that can be detected on scans. Not scans, on biopsy. But that amyloid is different from the amyloid of microthrombi. So they're not the same thing. Having said that, perhaps long COVID has unmasked and previously unnoticed early dementia. So, dementia is, unfortunately, sadly, with the aging population, not uncommon, okay? And the commonest, there are two types. There's multi-infarct cerebrovascular dementia, and then there's Alzheimer's disease. And so it is common, and it builds up slowly over a long period of time. Gradual worsening of symptoms or presentation of symptoms, but it is so slow that often it goes unnoticed. Okay. When COVID comes along and hence long COVID, then it can, if you like, accelerate it or unveil it or unmask it, and suddenly it brings it sort of increases, exaggerates that previously sort of unnoticed early stages of dementia. So your GP will be able to distinguish between those and sort of taking the history and examination, hence the importance of go to your GP with this. And he or she may well do something called the MOCA test, which stands for the Montreal Cognitive Assessment Test. And, if you score less than 17 out of 30, then that would probably trigger a referral to a specialist, a dementia specialist in elderly care, or even a neurologist for further assessment and probably an MRI scan then. So, like I said, long COVID is not a direct cause of dementia. The amyloid protein of microclots in long COVID is not the same as the amyloid of Alzheimer's. If you're worried, obviously talk to your GP. She will be able to distinguish between what is worrying, sort of memory problems, and what is not. So, having sort of talked about how it presents, how it affects you, with and the descriptions patients that I've heard of so many times, and the effects on the memory and effects on the concentration, etc. Let's go one step further and talk about the causes of long COVID brain fog. Again, like long COVID fatigue, there are direct causes and indirect causes. Okay, let's talk about the direct causes first of all. So, first of all, there's the effects of the damage that the virus has done on the brain. And we know that the virus can get in to the brain either directly or indirectly. So directly, the virus can travel up the olfactory nerves in the nose. Remembering SARS-CoV-2, coronavirus, is a respiratory virus. So you get it by, we all remember masks, yes. So you get it by inhaling it, and so inhaling it through the mouth or the nose. But if it's through the nose, there are nerve fibers, the olfactory nerve fibers, that are lining the inside of the nose. And so if the virus attaches itself to one of those cells, then that can cause spread up that nerve through a bony mesh called the cribriform plate in the base of the skull, into the brain, to the olfactory bulb, and then on into the sort of the core, the center of the brain. Okay, so there's the direct invasion of the virus. There's indirect invasion as well. SARS-CoV-2 virus, clever thing, nasty clever thing, can inject itself inside some of the innate immune system blood cells, the macrophages, that actually attack foreign invading particles. So those macrophages, part of the immune system, can be, if you like, the storage for the SARS-CoV-2 virus. The macrophage can then be carried into the brain because the blood-brain barrier has been weakened. I'll come on to this in a minute, by inflammation. And so then that's another way in which the virus could get into the brain and cause its damage throughout the brain, but specifically in those areas that we're thinking about, thinking brain fog, the hippocampus, which is where the short-term memories are laid down and consolidated. So there are studies, MRI studies, to show that the hippocampus is affected. And also the amygdala. The amygdala, which is the sort of the anxiety, fear area, not too far from the hippocampus, still part of what we call the limbic system. The studies, scans, show that the virus can be concentrated there and bring about its inflammation there. So that's direct viral damage of parts of the brain. And if those parts are affected, then that leads to those symptoms, with the hippocampus being memory problems, so short-term memory problems that I was talking about. And then there's the anxiety element, and those areas link into something called the prefrontal cortex, as well as the occipital frontal cortex, and those areas are where executive functions happen. Remember, there's decision-making, the executive functions, such as making decisions, and sort of understanding concepts and having ideas, etc. So that's direct viral infection. So then there's inflammation. Inflammation can cause brain fog. Okay. Inflammation in the brainstem because of activation of the mast cells. So mast cell activation, you've probably all heard of, is common in long COVID. So there are concentrations of mast cells around the brainstem, also around the limbic system, in the heart of the brain, in the center, the core of the brain. And so then if this activation leads to inflammation, and if there's inflammation there, then that's going to cause malfunction of that part of the brain, the brainstem. I talked about the blood-brain barrier. So basically, the blood-brain barrier is affected, which is basically a network of blood vessels around the brain as a protection. It stops majority of largish molecules and cells getting through into the brain. But if the blood vessels are inflamed, which is a fundamental underlying problem in long COVID, then that leads to endotheliitis, and then that leads to a leaky blood-brain barrier. Those blood vessels, the blood vessels within the brain also become damaged, and then that reduces the blood flow to parts of the brain. Again, what we call PET scans have shown reduced perfusion, reduced blood supply to parts of the brain, specifically those areas that deal with short-term memory as well as executive function. Scans show it. I talk Another sort of cause, well, it's still on inflammatory. We've got the cytokines, the excessive, if you like, pro-inflammatory response when you're attacking the virus. Okay, so again, scans show that the brain's immune cells, the microglial cells, which are, if you like, the sort of the resident defense cells, the innate immune system cells within the brain. Scans show that those cells become inflamed, and those cells, if they're inflamed, again, that will cause malfunction within the brain. Again, another part of the inflammatory process, again, in the brain, again, proved and backed up by research studies and scans, the microthrombin, microclots with the amyloid that is therefore laid down in various parts in the brain. Okay, so lots of reasons for brain fog because of inflammation. Another thing that goes wrong and underlying cause for long COVID, of course, is malfunction or dysfunctional immune system, the acquired immune system. So, and the creation of autoantibodies. So, they found autoantibodies, antibodies that that attack your normal cells. You're attacking yourself. Your own antibodies are attacking yourself, not attacking things, foreign invaders. You're attacking your own cells. So autoimmunity. They found autoantibodies to nervous tissue, to nerves themselves, to brain cells. Another direct cause of brain fog is problems with the vagus nerve. The vagus nerve is the parasympathetic nerve. If that is activated peripherally, if there's inflammation around the body, the vagus nerve picks up that inflammation and then sends impulses to the brainstem. And then that causes an inflammatory response in the brainstem. And as I keep saying, inflamed brainstem, inflamed brain is not an efficient working brain, unfortunately. And then finally, dysfunction of the autonomic nervous system. So the autonomic nervous system, the automatic nervous system that deals with pulse and blood pressure and temperature regulation, etc. So that can be affected in long COVID, and there are lots of reasons, lots of causes that lead to dysautonomia, but basically it has an effect on the sympathetic nervous system, the parasympathetic nervous system, the HPA, that's the hypothalamo-pituitary adrenal system, the limbic system. I've talked about the limbic system, the sort of the hippocampus and the amygdala, and an effect on the brainstem nuclei. Okay, so this autonomic nervous system unfortunately also has interactions with the enteric nervous system that serves the gut, interactions with other parts of the glandular system throughout the body. So there are so many direct effects of having COVID, hence long COVID, that result in brain fog, and that's a long list. And those are the direct effects. The indirect effects of causes for brain fog are sleep disturbance. Now, most patients with long COVID have a degree of sleep disruption. This is not good. Sleep's, after all, so important for rest and restoration, repair. Okay, that's what happens whilst you're asleep. And sleep is sort of the sleep cycle is controlled by the day-night circadian rhythm cycle. Okay, and then that controls the release of various hormones. So release of growth hormone, the sort of, that is the repair hormone. Majority of that is released at nighttime. the cortisol is released in the morning. So again, part of the circadian rhythm, really important. That's cortisol. So that's your own natural anti-inflammatory, and it helps you. It's released first thing in the morning, and so when you're getting up in the morning, it helps you sort of get up and go. To tackle the stress of the day, basically. Also melatonin. Melatonin, the hormone that's in the pineal gland, deep in the brain, is also really important. Melatonin is the naturally occurring sedative that we all have in us, and is released at night in the dark. When it's dark, melatonin is released. That enhances sleep. Melatonin release is disrupted by the fact that there's dysautonomia, and therefore there's less release of the melatonin, therefore there's less of the natural sedation. So sleep is really important for us all. Sleep disturbance is a big problem in long COVID, as we all know. And so then if you don't sleep and rest and sleep, if it's not refreshing, then next day you feel, brain foggy type symptoms, don't you? You're not fresh, you're not as alert, etc. Sleep. Gut is another cause for problems with the gut is another cause for brain fog. So gut dysbiosis. So we know about the friendly bacteria in the large intestine. Yes, we do. And we know that in long COVID, patients with long COVID, their friendly bacteria, unfortunately, are depleted and are taken, and their place is taken by, if you like, unfriendly bacteria. Okay. We also know that. And that's not good, because we know that friendly bacteria are really important for supporting your immune system, for production of vitamins and production of energy, for the lining of the gut, production of neurotransmitters, production of some hormones. So that in itself, the knock-on effect of that, a poor friendly bacteria in the gut those effects are going to result in brain fog. But also, we know now about the gut-brain axis. And what's all that about? Basically, the interaction, the interplay between the gut and the brain. And, so if there's something wrong up here in the brain, then that has an effect on the gut. Okay, so just remember, school exam, just before you go to exam, what happens? You're worried, concerned, panicky maybe, and then what happens? You've just got to go to the toilet, don't you? And you probably have diarrhea. So the brain has affected the gut. Likewise, the gut. There are studies to show that actually, if things aren't right in the gut, then that can cause problems with the brain functioning, that is. Also with gut dysbiosis, there's reduced production of serotonin, which is if you like, the happy hormone. It's the neurotransmitter that keeps us from being depressed. It's made in the gut, and then it gets into the circulation. It's concentrated in the brain. If you don't have as much serotonin made in the gut, you'll have depletion up here. Therefore, you're more likely to become maybe a bit mood disturbed, depressed. When you're depressed, you do have, your thinking's not so sharp. You have sort of a brain fog type of element. I talked about melatonin. That's also produced in the gut. Okay, with reduced amount of melatonin, you're depleted of that. Then you haven't got that melatonin, which is then helpful, as I've explained, for its sleep enhancing properties. And then finally, another indirect cause for brain fog is the effect that the long COVID has had on you, your life, your circumstances, the stresses and worries and mood disturbance, anxiety, depression that it has brought. Okay, and understandable consequences on any patient. The effect, the impact it's had on your lifestyle and the dynamics within family and friends and not being able to do your hobbies, etc. So if you've got, and that all results in stress and worries and mood disturbance, then the stress, worries and mood disturbance are a major contributor to brain fog. So like fatigue, in my podcast on fatigue, these causes are proven in research. Okay, scans and blood tests can back up all these causes, both direct and indirect. They demonstrate a physical cause of the problem of, this brain fog. So it's not psychological. Your brain fog symptoms are not psychological. They are not imagined. It's not all in the head. Your brain fog is validated. It is a real thing. So there we are. That's part 1 of my talk on long COVID brain fog. So in part 2, I'll talk about the sort of how we're going to go about tackling it and the strategies and the outcomes. So I'll see you there.